COVID-19 vaccine shots for the year are rolling out. So we want to bring in Dr. Gary Kaplan for what family needs to know. Doctor, thank you so much for joining us here live on Fox 5. Absolutely. I want to begin, though, with the confusion when it comes to COVID-19 shots in particular, because you have our Health and Human Services Secretary saying one thing and the American Academy of Pediatrics saying another. Which guidance should families follow?
At this point in time, I'm following the guidance of the American Academy of Family Physicians, the AMA, the American Academy of Pediatricians, the American Academy of Internists. I am following the literature that has studied these things and made recommendations accordingly.
Is there anything different about this year's flu and COVID season compared to the last?
So the problem is COVID, like flu, continually mutates. So you kind of have to get updated vaccines on a regular basis. The COVID vaccine, I want to emphasize, is safe. I want to emphasize is effective. And, you know, the more COVID episodes you get, the higher the probability of developing long COVID. Long COVID can actually completely destroy your life. And about 10 to 30% of people who get COVID will end up with long COVID. So we want to do everything we can to prevent the occurrence of this disease. And the vaccines are one of the best ways to accomplish this. So vaccines, typically 1 to 2 shots a year, depending upon your age group and your risk. Sometimes a third shot might be helpful for some people. For flu vaccines, definitely I would get them. But for this area, we tend to be a little bit later in the occurrence of flu. And so I tend to encourage my patients to get the flu shot, maybe October, early November, because the flu shot lasts for about 6 months.
Okay, is that recommendation still the same for kids in school as well?
Yes. Yes. So there's not mandates anymore. Okay. So really you can consult with your physician and see what makes sense for you as an individual, because not every, look, people have reactions to the flu shot. People have reactions to the COVID shot. But the reality of the matter is the reactions compared to the consequences of the disease itself, minuscule. And so you're much safer getting the vaccine than you are getting the disease.
When it comes to getting the COVID-19 shot as well as the flu shot, should you get them together or separately? Does it matter?
For the most part, the literature says they're safe, so I like to separate my vaccines by about 2 weeks. So you get one or the other first, probably COVID at this point, because we're in a COVID surge right now. So right now, we want to make sure we're protecting ourselves, and it takes about 2 weeks for the vaccine to fully ramp up to protect you. So I would tend to do COVID first, and then in a couple of weeks after that, you've done fine, then I would do the flu shot.
Can you address, since we have you here, Doctor, the impact of mRNA vaccine funding cuts, particularly when it comes to COVID?
I think I'm truly disappointed. We have an opportunity. The messenger RNA vaccines are the first truly massive innovation in vaccines in decades, and they hold massive promise with that, meaning that they're going to be useful also for treatment of some cancers. They're going to be useful for treatment of diseases we can't presently treat, such as malaria. So the reality of the matter is messenger RNAs are the most significant advance in vaccine development in decades. They hold huge promise for a large number of diseases, and it's really a shame that we've lost the opportunity to fund the studies that need to be done to make sure we're getting the best science and the best use of these vaccines.
And we hear and we know that when it comes to vaccinations, that's one of the best ways to safeguard yourself against these illnesses. What are some other ways we can reduce risk?
Well, simple, stay healthy. We want you exercising. Exercise is probably one of the best things you can do in order to preserve your health, both aerobic and anaerobic, meaning doing weights. You want to make sure you're getting plenty of sleep. 7-8 hours of sleep a night is kind of a must. You want to make sure your nutrition is good. There are some supplements you can take, such as quercetin and vitamin C, that can be useful, and probiotics. And you should get your vitamin D levels checked. Vitamin D is essential for a normal functioning immune system, and your vitamin D levels should be probably about 50 to 80. 30 is considered the absolute minimum.
All right, got to keep that immune system at a maximum level for sure. Dr. Gary Kaplan, thank you so much for your expertise and your time. I think you answered a lot of our questions that our viewers have been wondering about. We appreciate it. Take care.
My pleasure. Thank you for having me.